My name is Guy Lemunyan, and I am the coordinator for SMART in Northern Arizona, and I've recently been appointed as regional coordinator for the state of Arizona. This video is a recreation of a talk I did in 2013 at the SMART Recovery Conference. There was a video recording problem, and it did not come out so well. I began in rational recovery in about 1990 in Southern California. I learned about rational recovery from a psychologist who was treating people that did not like the 12 steps. And I got involved with Jack Trimpe, started doing groups, presented rational recovery at a California conference on alcohol problems, the National Association of Alcohol and Drug Abuse Counselors. I was on the original Rational Recovery Board of Directors, which preceded the Smart Recovery Board of Directors. I published many articles in Journal of Rational Recovery, and I'm cited in Vince Fox's books, Addiction Choice. I moved to Arizona and found no SMART groups in northern Arizona, so I've started two at the VA Veterans Hospital in Prescott, where I was working, one in Flagstaff and one in Sedona. And I've been able to get a couple of articles published in newspapers, and that's free publicity. I've been using the relapse prevention concept since before rational recovery, starting in 1983, and taken many trainings in relapse prevention from relapse prevention expert international trainer Terence Gorski. More recently, I developed a 44-bed relapse prevention unit at the VA hospital in Prescott. This program took people that had had 4 or more previous full rehabilitations. So I'm very aware of the issues in relapse and how to help people that are chronic relapsers. Ms. Gorski says the most predictable outcome from rehabilitation is relapse. And if you don't understand relapse, you don't understand addiction. And we acknowledge that relapse is part of recovery for severely relapse-prone individuals. First publication I'm aware of is 1982, this Counseling for Relapse Prevention book by Gary Gorski and Miss Miller. Next, 1985, came Alan Marlat's book. Alan Marlat is a professor of psychology at the University of Washington and director of their Addictive Behaviors Unit. Later, and before his early death, Alan Marlat assisted in the creation of mindfulness-based relapse prevention. We'll talk about that more later on in the presentation. What are the rates of relapse? How often does it happen? The rate of relapse for addictions is 40 to 60%, and that's compared here in this graph to diabetes, hypertension, and asthma. So it looks pretty much the same. When does relapse happen? This graphic shows the majority of relapses happen within the first 90 days. The 12-step people recommend additional support during this first 90-day period, that is 90 meetings in 90 days. A meta-analysis at the University of Washington by Dr. Marlat's staff found that relapse prevention techniques are superior to treatment as usual, which means the 12-step approach. Also measured was mindfulness-based relapse prevention, which is found to be helpful in early recovery, but the results wash out by about month 4. Marlat also studied triggers. What causes relapse? This is from most to least. Negative emotional states, social pressure, interpersonal conflict, which can include relationship problems, urges and temptations to drink, which I thought would have been actually more. Testing personal control, I can have just one, or maybe I can return to controlled drinking. Positive emotional states, many people like to celebrate with drinking, and negative physical states, that's chronic pain, other physical problems that people may be using alcohol or drugs for self-medication. SMART tools for relapse prevention are available on the tools page of the website and in the manual, including triggers worksheet, um, forward steps to recovery, making recovery plans, lifestyle balance, and others. And included in the manual is a technique disarm, thought stopping technique, and urge surfing technique. We talked about urge surfing earlier, and you saw this slide once already, and this is something that's included in the mindfulness based relapse prevention recordings I'll talk about in a minute. And sober breathing space. So when cravings come, and control of cravings is a major part of smart recovery. Stop, observe, watch what's going on, take some breaths to get your thinking back, expand your awareness, and respond mindfully. No automatic thinking and automatic responses. If you'll slow down, stop, observe, breathe, and expand. The small book by Jack Trimpe is still on the Smart Recovery reading list, and the BEAST method to resist relapse is still okay in my book. So this is recognizing a boozing opportunity, or in the case of overeating, the feast beast, or in the case of smoking, Smokey the Beast. Recognizing the enemy voice, that is the voice telling you to, it would be a good idea to drink, use drugs, smoke, whatever it might be, and accuse the voice of malice, that is trying to harm you, which is certainly irrational. And Trimpe said, out loud if necessary. Talk back to the voice out loud if necessary. And he encouraged self-control, you're in control, and reminders about your own self-worth, and every episode of resisting builds more self-worth, and to treasure your sobriety. The rest I'm going to talk about the Gorski synapse model of recovery in 3 sections: the developmental model of recovery, relapse warning signs, and the post-acute withdrawal. First, about relapse theory. Relapse is a part of the management of any chronic lifestyle-related disease, and we saw that in the graphic earlier with the bars. It's unrealistic to expect a 0 relapse rate as an outcome standard. It is realistic, however, to reduce the rates of relapse and manage relapse episodes more efficiently. These are the critical indicators of effective relapse management, or how to tell if a relapse prevention is working. Frequency, relapsing or lapses, slips are occurring less often. Duration, they're getting shorter in time period. Severity, there's fewer consequences, both socially and physiologically. And insurance companies like to know that they're saving money by paying for less services for people who are relapsing less. Next is developmental model of recovery, and here I've done a crosswalk to compare the stages of change model, Prochaska and DeClement, used by SMART, and the Gorski synapse model. And you'll see in the left column, when it's time to actually make the change, Prochaska and DeClement just say action, whereas on the right-hand column, the Gorski synapse developmental model separates these tasks into early, middle, and late recovery, and maintenance phase is the same. This model is developed by clinical observations, interviews with long-term sober alcoholics, interviews with experienced counselors, and a literature review. These are more naturalistic methods as are used in sociology and anthropology research. Next is a 37 relapse warning signs. This is available in the Journal of Studies on Alcohol article by Miller and Harris 2000, wherein they tested the 37 relapse warning signs to see which are actually effective in predicting relapse. So these are of increasing severity, beginning with I feel nervous and unsure, I have life problems, I overreact, I feel lonely, I get focused on one area, I feel down or blue. I engage in wishful thinking. My plans don't succeed. I have trouble concentrating. I think things won't work out for me. I feel confused. I'm easily irritated. I feel angry or frustrated. I'm not eating well. I feel trapped, that there's no way out. I have trouble sleeping. Longer periods now, depression is increasing. I really don't care what happens. I feel like things are so bad, I might as well drink. Not able to think clearly, feeling sorry for myself, thinking about drinking, dishonest, that is lying to other people, feeling not hopeful or competent, feeling angry at the world in general, not doing things to stay sober, afraid that I'm losing my mind, and finally, out of control drinking resumes. So, how to use this is as a group exercise, an individual exercise, or a homework assignment. For a group exercise, you can download this from the page and pass out copies and let people mark and their score these, and they'll be presenting their own likeliness to relapse according to this scale, which has been verified by research, as I cited earlier. This introduces the addicted self versus the sober self concept. Psychologists estimate we talk to ourselves at 300 to 500 words a minute. One of the voices, and when in the drinking episodes or the drugging episodes, the addicted self is in charge. The little white dot, however, is the sober self that comes in with nagging voices saying, shouldn't be doing this. You promised your mother, father, sister, brother, doctor, nurse, aunt, uncle, minister, that you wouldn't be doing this, and here you are doing it again, leading to negative feelings. Conversely, when the sober self is in charge and people are off alcohol or drugs, the other black little nagging voice is often saying, you can handle just one. It'll be okay. Don't listen to those people. They don't know what they're doing. You take control. So the characteristics of the addictive self as described in Passages Through Recovery by Mr. Gorski is mean, angry, lonely, greedy, uh, doesn't want you to succeed, wants to have short-term fun, and actually willing to uh, take you all the way to death's door if you don't make a change. Conversely, the sober self is intelligent, warm, caring, strong, in touch with weakness, asks for help, and is able to help others and gets involved with other people. And that's also from Passages Through Recovery. And the goal of recovery is to put the sober self back in charge. And I think you'll see that after this presentation. Some people in AA 12 steps describe this as I've got the devil on one shoulder and an angel on the other shoulder, and I'm in the middle, and they're confusing me. So, for the developmental model of recovery, early, middle, late tasks, the early tasks are to write a drinking history and a relapse history. This helps people take responsibility and increase motivation. Uh, they learn to identify relapse triggers and warning signs, and I've given some tools that can be helpful, and to develop a relapse plan and an intervention plan. If I should relapse, what should I do? I'll call this person, arrange for a detox, go to Smart Recovery, seek other help. And very important, again, is stress reduction, relaxation training, particularly in this first 90-day period, as you've seen. Middle recovery tasks now are focused on interaction with society. That is, keeping or gaining stable employment, resolving family problems, intervening in any relapse problems, and resolving post acute withdrawal problems. Late recovery tasks are addressing childhood trauma, adult trauma such as rape trauma and other traumas, and military trauma for the people with PTSD. So, in summary, early recovery, the emphasis is on self and addiction. Middle recovery, the emphasis is on self and society. And late recovery, the emphasis is on self and the past. Post acute withdrawal symptoms are common and often not talked about. Uh, Major emphasis is to provide education. Stress reduction helps with reducing these symptoms. Avoid stimulants and sedatives, they make it worse. And help the person realize that is short term, that it will improve over time, and encourage them to continue their recovery. Good references are found on this in Wikipedia and post acute withdrawal. And if you look at the bottom where the references are, that'll take you to much more information about post acute withdrawal. More about relapse prevention can be found with a free download, Technical Assistance Publication TAP Series 19 by Mr. Gorski. The title is Relapse Prevention with Chemically Dependent Criminal Offenders. However, only the last chapter is about criminal offenders. The rest is relapse theory, relapse treatment, and in the back pages, there are helpful exercises that can be used for relapse prevention. If you have questions, please let me know. Email me at glamunyon@aol.com or by Facebook, Guy Lamunyon, or using the SmartCal email system. If this has been helpful for you, please let me know. Thank you for listening.